heart. I'm close, but I'm not right on it. It's a little bit peripheral. I want to get right over the heart. This is all abdomen for sure. I need to know if it's lower than this or higher than this.
You mean her abdomen or
the baby's abdomen? This is the baby's back right now.
Okay.
So I've got the baby's back and the abdomen all right here. So I think one of the things that's going against us right now, and it doesn't make any hill beans on the end result, that the baby's a little posterior. Okay, so it's facing up instead of back. If you were later in the pregnancy, let's see if I can get through that. Okay, now I get through the heart, or through the chest here. Hear the difference of the heartbeat? See how I'm angling the probe this way?
Yeah.
Okay, so basically the baby is facing this way. So I'm getting through the chest down here. Now I can hear it all through here, but the way that the baby's positioned, it's actually easier for me to go down through the chest this way. Usually if the baby's, let me see if I can describe it. Usually, let me get my doll out. Right underneath you in that bottom drawer is a doll.
Ah!
See him?
That is freaky.
That's Baxter.
When you say posterior, do you mean he's closer to like her back?
So this
side,
is, yeah, so this is how I think the baby is laying right now, like this, like that. Okay.
Okay.
And so I'm trying to listen for a heart rate here, and it's not coming really clear. But if I go like this and listen this way, I can get it really clearly.
Mm-hmm.
Okay. And so one of the reasons you're feeling all this, I just wasn't sure if the baby was sitting like this or like this. But I'm pretty sure the baby is head down at this point.
Will he stay head down now?
He should stay head down.
Yeah.
He should stay head. Some of them are really tricky and they don't, but it's pretty rare. Once they go head down after 28 weeks, they usually stay head down. I'm going to feel one more time. They usually stay head down. Yeah, I can't. There's definitely no back on this side. This is all.
So you can tell there's nothing like over
It's
here.
all limbs. It's all limbs.
It's all limbs.
Yeah.
Probably long limbs.
If I wake the baby up, we'll probably get treated with a little bit of activity. I don't feel a whole lot of limbs up here, but there's not a head up here either. Yeah, you've really got muscles right here.
That'll probably be helpful for birth, right?
Yeah. All right, so take your hand, go right here, take this one, move Baxter. All right, feel how firm this feels? See how it feels like back, and see how this is squishy? Okay, so this is all back here.
So I've definitely felt that before, like sometimes you're like, the baby is all over here.
It is, it's all on this right
You
side.
see it. You
Yeah,
can
now
see
that
your
you're-
baby's your belly's lopsided.
Okay, here you go. Pretty sure that's bum. Feel how it feels kind of pointy? I'm pretty sure that's bum. And then take your fingers and go right where my fingers are, right here. Okay, like that.
Yeah.
Okay, I'm pretty sure that's a head. You see how it goes between your fingers
Yeah.
like that? Yeah. And I was looking for, like, usually when a head is down like that, when you press on it, it wobbles like this. That doesn't feel so wobbly to me, so I can't decide if it's definitively, but this feels like a bum to me. It's irregular. Feel how it feels irregular?
Mm-hmm.
Okay.
Yeah,
Feel how it
not
feels
like a
irregular.
round head.
Yeah, usually when you have like a little coconut up there, just, you know, like you press on it, it's doing this. It's literally doing this when it's in there, so it feels like a little round coconut. Yeah.
Okay.
Another 3 or 4 weeks, this will become really, really obvious and easy.
How big is the baby now, do you think?
Oh, I'd say probably 3 pounds maybe.
Mm-hmm.
Yeah, right there. That's the size of the baby right now. Thin, you know, it's real thin. But I've got a shoulder here. Take your finger right there. It's kind of pointy. That's a shoulder right there.
Is that
It's round but
hurtly?
pointy.
Doesn't hurt. Like to be pushing and prodding like that.
No, that's the shoulder right there. I'm pretty sure. I keep thinking I feel a little something right here. You ever have anything that protrudes out here?
Yeah.
Yeah. I think this is a
Feel like nail on the
little
head.
part.
I always get a pull in this groin area too. Like, you know how sometimes it feels like you get a Charlie horse there and you're like, like it, like in one day it happens like 7 times.
Yeah.
Like you get a
Well, you got a little baby
thing
right
down
there. Like,
yeah.
you know, there's a lot of stuff happening right there.
Yeah.
Yeah, there's a lot of baby right there. Yeah, if you imagine this baby sitting in that space, right there.
Yeah.
Yeah, I guess you figure half the belly.
It's big.
Yeah, I mean, baby feels like a great size to me. Doesn't feel really big.
Are you leaning more towards Adrian right now? Because
Yeah,
your
I'm
belly.
diagonal.
Oh, okay.
Because your belly does look more, it just looks more solid on that side.
Yeah, that's exactly
Especially
what
on
it
this
is.
side.
Yeah.
I'm like, I can't push hard because I feel like it's not
Well,
good.
come over here and then use both your hands. Hands warm. Okay, ready? Some fluid.
Yeah.
When you go over here, you see how that feels firm?
Yeah.
Okay, and then when you go right up here, here's bum. Pretty sure. Feel how it feels irregular but hard.
Yeah, it's almost like fibrous.
That's bum. That's butt cheeks. I'm pretty sure.
Good butt cheeks.
And then
Oh yeah.
right here,
Is this okay with you?
Yeah.
see where my fingers are right here?
Yeah.
You take your fingers and put them in there and go down in. But you really have to go in there.
Is that okay?
Yeah.
I feel like it's gonna
No.
pushing so hard.
No, those babies are pretty well cushioned in there.
Oh,
Do you
yeah.
guys feel between your fingers?
Yeah.
Yeah.
That's so cool.
Yeah.
He's in there.
I think you're good. Yeah, see, you've got a little part up here, Jason. Right there.
Yeah.
If I push it, if we do this to the baby decides it's going to push it out.
Will
That's
she
okay.
have another ultrasound before? the
She doesn't
baby?
have to. I mean, there's no real reason unless we were suspicious of something problematic. There's not really a reason to. You know, if we get suspicious of position or things like that, then, you know, there's always a reason to do it. But otherwise, no.
So that's a good position right now because his head is down, even though he's like chilling on one side.
Yeah. I mean, my hope is that he'll roll a little bit more towards the front, which, you know, if he doesn't like to do that, we'll just be a little encouraging for that. There is ways to position your body during the day to get him to roll around to the front instead of being posterior. But, you know, at this point in the pregnancy, it's not really... I mean, tonight the babies could roll around in a complete circle 3 or 4 times. That's you know, pretty common.
Okay.
Yeah.
As far as sleeping, do I have to always sleep on my left side, or is it
No.
okay if I sleep on my right
You can
side?
sleep any way you want.
People have scared the hell out of me.
No.
Like, you're going to cut off blood to the baby.
No.
What?
Okay. I'm serious.
So
The dentist wouldn't even let me sit in the chair without going like this because he's like, you're going to cut off the artery to the baby.
So what it is, the largest vein in the body goes down past the spine, okay? And so blood goes out of the heart at force, but then it comes back not by force. There's no pump, okay? And so it's being pumped out and oxygenated to the lower part of your body. And then once it gets down here, it can't figure out how to get back up. And so when you're standing up, it's harder, which is why you get swelling on the lower part of your body. Also, too, if you think you've never had anything large, that, you know, nothing bigger than a hair sitting on that large vein going, now you've got this enormous belly with all the fluid and the baby sitting on it. So when you lay on your back, it compresses that vein. Now, it's the same thing, but you have to stop and think to yourself, if too much blood left your brain and didn't go to your brain and it ended up in the lower part of your body, you'd start to feel pretty yucky. You start probably faint, okay?
Yeah.
So women who have that compressed vena cava that come up, they usually feel very air hungry, they get nauseous, and they literally will like violently throw themselves over, like, I can't breathe, I have to sit up or do something else. So when you have your wits about you and you're not altered and you're not unconscious or you're not under drugs or anything like that, you'll advocate for you and your baby just fine. Okay. Most women, when they hit the end of their pregnancy, don't like to sleep on their back. One, it's uncomfortable, but two, it makes them feel out of breath.
Yeah.
Or they'll wake up in the middle of the night and they'll have been on their back and they can't figure out why. They're like, their heart is beating in their chest, and all of a sudden they feel like they've just been rocketed out of bed. And it's literally that you've woken yourself up from a sound sleep. You know, probably haven't laid on your back for a few seconds.
Yeah, laying on my back is certainly not the
Yeah.
most comfortable, but I didn't know
Yeah.
if like
Yeah.
sides.
No,
made a
no.
difference.
It's got a lot of press time, and so, you know, what we have to think is, if you're completely with it and you're not altered in any way and you're conscious, you know, even if you're sleeping, you're not going to do anything that's going to make you unconscious, you know. Yeah. So, any way you want to sleep is fine.
Thank you.
I don't think I have any other. Did you have any questions?
No, I think so.
Okay.
Yeah.
I don't think so.
Yeah.
I know. You got 3, Mom.
I get 3. Okay. I want to know. Worst case scenario. She's going through labor.
Yep.
Something's not right. How far away is the emergency?
We're about
vehicles?
7. Oh, the emergency vehicles are 2 blocks away.
They're right around the
They're
corner.
right around the corner. They're
Okay.
literally right around
And
the
do
corner.
they know when you've got somebody in here?
So I'm also a firefighter and EMT, and so I do the training for the local groups. We do training twice a year with them, and they're a really remarkable group of people. I can't say enough good things about them, and I think that we've developed a rapport with them over the last 10 years. They realize that we're not fruitcakes, you know. I mean, when people hear midwife and birthing center, they think that you're some nutcase, and I don't. I think there's a big
It's a
difference. I
bad
mean,
rap,
I believe
yeah.
in evidence-based care, and I believe in safe care in every way, shape, and form. So when I dial 911, they're 24-hour day staffed paramedics, 7 days a week. There's no break in care. And they're a great group, and they're very well trained, and they always send a paramedic response here, which is great. So I know that I'm getting the highest level of care for the families that are here. And most of the time when we have a 911 transport, it's not for an emergency reason. It's for, well, we've been up 3 nights, and now you're exhausted, and like labor's not progressing very well. And I mean, that's the most common reason we transfer out of here. If we have a baby that doesn't sound really good in labor, I'd rather take you early before it becomes an emergency, rather than take you at the end when the baby's like not doing well. That doesn't make any sense whatsoever. I'd rather be down there in Nashua rather than have an emergency here.
And that's where you go to, Nashua and St. Joe's?
We go St. Joe's or Southern New Hampshire, depending on what the staffing is and who's on call and what their capabilities are. Sometimes the hospitals are full for no real reason. We can also go to CMC or Elliott Hospital. They'll transfer to either one. If time permits, I give you your choice of anyone that you want to go to.
So how are you set up here for the delivery of a baby that's got an issue and is not doing well?
Well, it depends on what the issue is. If it's a baby that's not breathing when it's born, we all can do neonatal resuscitation. We have all that set up back there in the back. Babies really, like, they come out and their heart beating and their breathing. As long as you can sustain those 2 processes, they're fine. It's usually the mom that's a little bit more dicey, truthfully. And for things like postpartum hemorrhage, and we have Pitocin, and we have Methogen, and we have IV fluids, and we have Lisaprost. Like, we have all that here. That's all part of our standard of care. It's all part of our scope of practice. And so if you don't respond to medications, common medications, we go into the hospital. That's a good indication, to go into the hospital for sure.
But like that thing that happened to me after I had Dylan in the hospital, she just mentioned that the hemorrhaging, like the pill, the whatever they did that inserted in me.
Yep.
Yeah. She has it here. They made it seem like if you weren't here you would be dead, but clearly not because they have that stuff.
Yeah, no, we have all that here.
Yeah.
And what's the typical stay here?
2 to 12 hours, usually. I mean, most
2
women
to
want
12
to leave.
hours.
Yeah. And then we come to your house afterwards. We come and care for both the mom and the baby within a few hours after they leave here. And then we come again at 3 days. So we come at 1 day and 3 days. And so it's not like that you're not getting care at that point. And some women need to stay for longer than that, and that's fine. But when
you're going to be so happy to be home.
Yeah, when you're not anesthetized and, you don't have an epidural in place and you've had a natural childbirth and, things like that, most people want to leave after a couple hours. It's not that we're kicking them out. They literally want to go home at that point. When everybody's stable, you can get up, go to the bathroom, you fed your nice meal, the baby's had a full newborn exam and a neurological development exam, like we do all that before you leave. Yeah.
Do you do the newborn hearing screening here?
We do. Yep, we have the equipment to do that too. Yep. And pulse oximetry, yep, and the newborn metabolic screening for the blood work, and we do it all. Yeah.
Jill's going to school for speech pathology.
Yeah.
I'm
So is there
excited
really
for it.
any need for any hospital follow-up at any point if it all goes
If
well?
all's normal, no, we can do it all. It's part of our scope of practice. We can do just about everything. Yeah, we can even do the well woman care afterwards. We can do, all primary care, gynecology, birth control. We do it all.
Adrian,
Ultrasounds here.
can you talk a little bit about the delayed cord cutting thing again?
What would you like to know?
Just run through it again quick, because I was trying to explain it to somebody and I couldn't,
Yeah.
I never heard
Talking
of it,
and-
but that totally makes sense to me.
Yeah. So up to 1/3 of the baby's blood volume is in that placental circuit at the time of birth. And so subjecting the baby to clamping the cord early is almost like subjecting the baby to a massive hemorrhage at birth. I mean, it's very... the reason that they have done it historically is that in that placental circuit, because the baby can't oxygenate by taking in air, your hemoglobin is one-on-one with oxygen in the body. So in order to oxygenate the brain and the vital organs, you need to have enough oxygen going around, so you have to have enough red blood cells. Because the baby's not taking in breathing, the baby's getting it through the maternal bloodstream, it has to have a higher concentration of red blood cells in order to get enough oxygen to go around the body. After the baby starts breathing, now you don't need all that extra red blood cells. And so the body has to get rid of the extra red blood cells. And red blood cells are something that is cyclical. They come and go. They are not in your body like for life. They die after, a short period of time. And so the baby basically at this point is left with, all right, I don't need all these extra red blood cells. And so they start to die off. And the liver is responsible for kind of processing them out of the body, for a simple way of looking at it. And in the processing it, as it starts to break it down, the liver is very immature in a newborn. And so as it breaks it down, the byproduct of that breakdown is bilirubin. And so the liver can't really get rid of all that bilirubin. It has a hard time, so they turn yellow. And baby, it kind of leaches out through the skin. So normal physiological jaundice happens after that 24-hour time period. It's actually fairly normal. The jaundice that we really have to worry about it when it settles in the brain is when it happens in that first 24 hours, and then usually that's a blood incompatibility issue between the mom and the baby. Now, some babies who have that physiologic jaundice also have too high of levels, and they become very lethargic. They don't nurse very well. They sleep all the time. They turn funny colors. colors, among other things. That's how you can look at them and tell. And now we have blood work and stuff, but that's extremely rare. So the reason they started clamping cords early was they realized, one, that they clamped the cord early